This is another beautiful day with Healthy Living with Nonye Soludo's show. And today we are going to treat a very interesting topic, which is uncovering hidden health threats that can cause sudden collapse and death. And with me here, we have Priska Wankwo, we have Dr. Vidike.
And of course, Dr. Wabara is also here. He is a cardiologist. And just like Her Excellency has pointed, she has a mantra. She says, to live healthy is to live happy. And that is what the Healthy Living with Nonye Soludo initiative is all about. And today we've decided to talk about something very important. A local balance, like the Commissioner for Health will always say, some persons will say is slump and die. Like somebody is healthy 1 minute, the next minute the person is on the floor. And before you could stage your province or call for an ambulance, the person is no more.
It's gone.
And a lot of people will attribute it to so many. It's easier for us to attribute every health condition that you cannot explain to jazz or juju or village people. But today we brought the experts to come and educate us with regards to some of these hidden health challenges that we might not know that we have, that can cause somebody to just collapse, and the next thing, the person is no more. But before we do that, if you look at Her Excellency, you see she's wearing a beautiful t-shirt.
Yes.
And all you need to do is just focus on the description of that t-shirt, and that will tell you what it's all about. But I'd like her to tell us, what's this farmer's market is all about?
Farmers market, yes. We actually launched farmers market today.
Wow.
Yes, we started with local Demili North, where we launched Healthy Living Garden today. The local government gave us a large place, to do our garden, to do garden for them, not necessarily us. But we'll train the people that will do the garden, and we provide all the seeds they need for the garden. We provide all the vegetables, cabbage, cucumber, lettuce, everything, corn. And what we want to achieve is we are launching farmers market in 3 months' time. So we'll go to all these local governments and launch farmers markets for them. And what is farmers market? Farmers market is where the farmers bring out what they produce from their farms and sell directly to consumers, in a very subsidized price, because they're cutting off all the intermediaries, are selling it directly to them. And since we are giving them all the seeds free of charge, it will help them eat healthy, because we'll teach them how to cultivate all these things organically. No chemicals, nothing. So we'll teach them how to grow healthy. They will be aware of, eating healthy. At the same time, socializing. The whole community will come out at a particular time to do this shopping. It's bringing the community together and socializing. And as they socialize, they're learning, they're coming together as brothers and sisters, which has really no more in our community. So that's what we actually...
That is a very wonderful initiative. Somebody referred to you as Superwoman. And they say, with all the things you've done today, you still have time to still come here to anchor on your television show. That is just simply amazing.
Thank you.
Her Excellency is a sucker for healthy living. And today we want to look at something very important. Like we said earlier, uncovering hidden health threats that might lead to sudden collapse and death. And we have Dr. Wabara Chukwude. He is an interventional cardiologist fellow. Because here, when you hear cardiology, it has to do with heart health. All right, so Doc, we're handing over the baton to you. Oftentimes when people talk about sudden collapse and all that, people always ascribe it to one form of heart attack. Is this true? Does this always have to do with something that has to do with cardiac issues, or is there more to this?
Yeah, sudden collapse will have the causes that can be from the heart. So, and that's the majority of causes is due to heart condition. And also we have non-cardiac causes of sudden collapse. For instance, when someone's sugar is low, it can lead to sudden collapse. If somebody has a form of what we call seizure, epilepsy, it can lead to sudden collapse. If someone has a thyroid disease and what we call thyroid storm, it can also lead to sudden collapse. These are non-cardiac causes of sudden collapse. But however, the majority of causes of what? Cardiac causes of sudden collapse. And this, if not reversed, it can actually lead to what we call sudden cardiac death. Now, what is sudden cardiac death or sudden death? This happens when someone develops symptoms within 1 hour and it leads to death if nothing happens. Now, what can be done if someone has sudden collapse? The person needs to be reassessed and start CPR. If you don't know the course, start your CPR. We have our AEDs here. Then this can be done by non-medicals. It can be trained and done by non-medicals. And we start your CPR and call for help. Then when you start it, most times the person recovers. Now look at the causes of cardiac causes of sudden collapse that can also lead to death. There are many of them. We have the majority actually are due to we don't really know what are the causes. That's the majority. But followed by that, we have what we call coronary artery disease. The heart is supplied by vessel, and when these vessels get blocked, it can actually lead to sudden collapse that can lead to death. So that's what we call coronary artery disease. Also, look at what we call arrhythmias. This can be seen when we do common ECG. If you do an ECG, it can actually tell that the person's heart is not actually, let me use the word beating, working fine. It's the electrical activity of the heart. If it's not working fine, this can be seen by ECG. There are many causes of it. In the young, we talk about the inheritable causes of this condition, what we call the Brugada syndrome. Don't mind my jargon. It's a medical term which this can actually lead to what we call sudden collapse and to death if not treated. Then what we call Wolff-Parkinson-White syndrome is also one of the causes of this condition if nothing done when the person collapses. It can lead to death. The person may also recover. Also, there's some form of what we call arrhythmogenic cardiomyopathies. This is also things can cause this. Then look at the structural causes, because when you talk about the heart, the one with structural. This can be actually diagnosed when you look at the person's heart with echo machine. So in this condition, the one that happens among the young is what we call hypertrophic cardiomyopathy. You can notice that some athletes, maybe footballers, that slump while playing football. So when you look at the heart muscle, you find out that the heart muscle is very thick. And when this is thick, when it gets very thick, the heart flow prevents blood from what? Going out to the vital organs, and this can lead to what we call sudden collapse and sudden death. Then also, when the person's heart is very big, what we call dilated cardiomyopathy, it can actually lead to this condition. And also, among pregnant women, there's one that happened among them, which we call peripartum cardiomyopathy. This happens when someone is pregnant and the last month of pregnancy happen to develop some symptoms, or within 4 months, 5 months postpartum, develop some symptoms. So when you do an echo, you find that the heart is quite big. And this happens when the person that's conceived at a younger age, or when someone have what we call multipara, have had more than 5 pregnancies. There are other conditions that can lead to this, as I mentioned, what we call coronary artery disease. This one, you can also see it. The common term is heart attack. It says someone has heart attack. So, but coronary artery disease is a broad spectrum of it. So when you do ECG, it can actually tell you this person has this condition. Or you do what we call angiography. When you put a dye through the vessel, look at the arteries of the heart, you can actually see where the blockage is, and this can be treated. So what can we do to prevent this?
Okay, we'll come to that,
Yeah.
Doc, later, but we'd like to hear from the commissioner. Now, the area I want to come is, he said something about EKG, right?
Yeah, EKG.
ECG. Okay, all right. The thing is that people, we don't have the habit of carrying out routine medical checks. Like you see, from January to December, somebody will just be living life, or else you fall ill before you go to the hospital. How can these routine health checks, how can they change the narrative with regards to this sudden collapse and deaths?
Yeah, thank you so much. Thank you, Dr. Wambara. Before I say something, he mentioned all these things, but you know that in the health, or as a human being, all those things links back to the having what we call the cardiac arrest. So because all these things you mentioned is also inversely cause of cardiac arrest, because when your heart is packed, every part of the body is affected. Like he mentioned, heart attack. A heart attack is more like a flu. You understand? That's why he mentioned the coronary blood flow. Then the cardiac arrest is now talk more of arrhythmias. That's the electrical activities in the heart, which he mentioned which could be hyper, brady, or tachy, depending. So, and in all these things, if you have ways of doing medical checks in the sense that because electrolyte imbalance in the body could lead to all these arrhythmic activities. You could see it, the potassium and sodium and all that, because these are the things that affect the electrical activities in the heart. And also, we mentioned the ECG and all that. But the issue is this. As a human being, we should have culture of saying once in 6 months, once in a year, we should rather actually do our medicals comprehensive, and we are making it as cheap as possible in the state. He did mention something on a stroke. I think that is another thing that can hemorrhagic stroke. You could actually have it sudden like that, and you are all there. And these things are something that you don't spend in the state now. All our hospitals, public and private, public hospitals, primary, secondary, and public secondary, you would go there and check your blood pressure, because if you don't check your BP, your heart will continuously, you are not taking your drug, and your heart will continue to enlarge. But what it means that the blood is pumping, the heart is pumping against the resistance, and you see the heart increasing. So these are the things. It's just that when you have a culture that at a certain age in life, you need to be doing some specific investigation. You have ECHO, ECG. In fact, last ESCO, Anambra State, the governor approved for us to get a modern ECHO at Amako Teaching Hospital. So that's we just approved it because you could imagine it wasn't available there. But we have it now, echocardiogram at Amako and EEG and all that we got. The essence of it is that people should go and do some checks, which could be ECG, X-ray. Then a doctor, have your doctor examine you appropriately. Because if you are having diabetes, you don't know. You can trip you inside hyperglycemic coma state, and just go. And the treatment is just something that you can easily reverse like that. But if you don't know, at the end of the day, there is practical example when we had flooding at Obalo, Mr. Governor visited there, because we have all brought them to camp. So one man there was trying to grade the governor, what we had back. We took him there, immediately we checked the sugar, the glucometer read high, HI. And we just use insulin. We just started the treatment, and within normal saline, within 30 minutes, 1 hour, the guy got himself completely. So these are the things that we should be. It's a culture. The people used to run away from this because of the cost of it going to. But now, in the basic ones, when you go to the government-owned hospitals, we provide them. Go there, you do it, and it's at a very cheap rate. Then we have insurance coverages in the state. Our own is 12,000 naira. Among the federation is still cheap. So we have actually tried to bring some basic investigation inside the insurance, so that when you are registered, you go and do we call it just medical checks that checks their baseline. When you do those things, it could still happen. There is some that could not be explained, because I know that in the world, every second somebody is having cardiac arrest. Every second, every 3 seconds. somebody that is falling because of cardiac arrest. Yeah.
Okay, all right. Quincy, earlier I said that it's easier for people to attribute every health condition they cannot explain to village people or jazz. Why do you think people were fond of doing that?
Thank you so much. Anyway, we've heard from our medical experts, and coming to your question, people, if you have headache, oh, my neighbor, the other day she told me I will deal with you. Is that what is? I'm just trying to advise our people to take very care of themselves. Headache is a symptom of something. So once you have headache, know there's something wrong. Check yourself. Go to doctors. Go to professionals to check what is wrong with you. Not just popping out paracetamol or Panadol to bring suppress the headache. Headache is just a symptom of something. Let's continue, as Dr. Afam said, routine checks, very important. Once in a while, do your blood checks. From your blood, they can say, oh, do further checks. From these counts, I think there is something more fundamental. So from there, if we can have that habit, somebody over 40, for certain age, let me not put, supposed to be checking once a year, go for comprehensive, as our Commissioner for Health said. In Anambra State, these things are very cheap. And if so that's all I can tell them. Nobody is doing you. Go and check yourself first. There's nothing like your neighbor is. If it's possible, there won't be any human being on the road anymore now.
Okay, Excellency, before we go for a break, and when we come back, we'll now show a practical example of how, what to do when somebody suddenly collapses. Is the first thing to go on social media or to do CPR? Do people even know CPR or a basic for sleep knowledge that could help revive somebody that has collapsed? When I was doing research about this topic, I saw somewhere that nutrition, diet, and the sedentary lifestyle, all those people that will sit down from morning to night, that it can also cause some of this health.
Yeah.
Now, as somebody that is very particular about physical fitness, with your everyday Saturday workout, I'm still recovering from, by the way, your everyday Saturday workout, how can this help, with regards to guarding people against some of these hidden health threats?
Yes, thank you. It's very important that we, this sedentary, is one of the pillars in healthy living with Nonye Soludo. Exercise is very key. Exercise is very key. Don't sit down for more than 1 hour without getting up, walking around and sitting again. There's something I tell people every day. If you have anything that can count, make sure you get at least 8,000 steps a day. It will help. Exercise is key. It helps for our heart. A cardiologist, it is very key for the heart, for the brain, weight management. We can't underestimate what exercise can do for us. And that's why it's one of the things, again, we launched today. That exercise, you were there with us on Saturday last week.
Absolutely.
So we are launching it in every local government now. Communities, they must start exercise every Saturday. Bring out people to exercise. It's very important.
Okay, all right. So doctors in the house, the first thing, when somebody collapses, what is the first thing to do? Is it for me to bring out my phone and start taking pictures, start taking video? What is the first thing I need to do?
Yeah.
I hope that's all. So we'll come back. You tell us after this time off.
Yes, welcome back to Nonye's Healthy Living Show. So, Dr. Mabara, let me ask you a question. What are the signs somebody will have to know that he's about to have this heart attack?
Yeah, most times the person will not have any sign. That's why we call it a silent killer.
Wow.
But sometimes the person may experience chest pain. When you experience chest pain, what's supposed to ring in your mind is heart attack. So that's one thing you should experience. You may have severe headache or the worst headache of your life, which we call thunderclamp headache. When you have this thing, it may eventually lead to collapse. And when this thing happens, it's something with the problem with the brain. Maybe that a brain artery ruptured and lead to sudden collapse. Also, you may experience that your heart is start beating, and you are aware of that your heart is beating. Ideally, your heart is beating without you being aware that your heart is
Yes.
beating. But when your heart is beating and you are aware that your heart is beating, it's not good. At times, it will be beating out of proportion. So when this thing happens, it's an alarming sign that can lead to sudden collapse that may eventually lead to sudden cardiac death.
Okay, all right.
Thank you so much. You know, as he was saying this in my house, I started noticing my face. So, no, why we say this is this. He mentioned something important. You have found in a very live media, somebody has collapsed, because collapse can happen anywhere. But that's by the way. Also, you can also have pain, chest pain, referring to the tip of the shoulder and all that. And you feel as if your pressure, your heart is squeezing. But I have a recent incident that happened. The woman just like collapsing. What she could talk, she was sweating, excessive sweat. Yes, because she's not getting enough oxygen.
Yes.
Yeah. Well, what she now did, she was getting deeply unconscious. So what she did was, I just happened. This happened 2 months ago. What she could tell me is this: she pointed my heart like this. She just made the point. This is a life story. 2 months ago, she just made the heart is squeezing, as she said. A coronary artery disease, because when you have already stopped giving oxygen to the blood stop through, oxygen stop going, you see it's the pain. So, and what we do, just simple thing, oxygen, nitroglycerin, aspirin, and you see the lady is walking now, walking actively, start. So these are the things, but if attention was not given, it will not lead to cardiac arrest, which by that time becomes totally unresponsive, and which we do what we're going to talk about later. But before then also, we want to thank the healthy living team, because if the cardiologist mentions something, Dr. Mabo mentions something, there are things that will lead to the things that will cause cardiac arrest. And if you look at what the exercise is doing in healthy living, nutrition, one, exercising. These are the two most important things that is very important, because if you watch, the first lady always say that you are what you eat. So if you do your diet, because from your diet you control both lipids, salt, and all that. From your diet you also see natural things. For the exercise, you also know that you need to keep in shape. So these are two most important things. No need to, because I know time is not.
Yeah, time is not our friend. Before we go over to the practical aspect of what we're talking, because I asked a question earlier. I said, if somebody has a cardiac incident or somebody suddenly collapses, maybe you are jogging and somebody just falls down, is the first response to carry water and be, splashing on the person? What is the first thing to do? The first response is to just carry your phone and start videoing, hey, somebody has fallen down.
That one is the greatest problem we have.
Media. Okay, let's care to speak about that, because young people are usually guilty of that. Carrying their phones and videoing people that are in certain bad shape and posting it on social media.
Exactly. It's one of the biggest problems we have now. You see somebody, see an accident scene, like there's one I saw on Facebook one day. It was a big accident. This man, the brain was open and he was still with the baby, still screaming, help, help, help. And somebody was busy videoing and sharing, happening now, happening everywhere now, something like that to do. And people will be video, just to post, create content, have whatever. So it is That's one thing we are telling people. That's not, you don't need to bring out your phone. You only bring out your phone either to call emergency, or now we are teaching people how to do this basic first aid. Yes, this, trying to help. We must, these are things we think we must do, make compulsory in this country. Because in places, some advanced country, Western world, before you get your driving license, you must know some basic first aid skills. It's a must. You must know how to help out. When you're on the road and an accident happens, you must know before you take exams and so on. So please, we are begging our people, don't bring out phone to video and put on social media just to create content. Help people who will teach you. Go to our YouTube channel and learn how to do all this first aid, yes, to help people in need. And then in Anambra State, we have these ambulance services. Call the number 2112, and our ambulance will be there to take the people. Thank you.
All right, thank you, Your Excellency Ma. Okay, Dr. Wabara, so like I asked earlier, what is the first thing you do when somebody suddenly collapses?
So the first thing you do when someone suddenly collapses, and you start CPR. That's the first thing you do. Start CPR, call for help. But before you start CPR, make sure that you are safe where you are. Start your CPR, call for help. Because that CPR can be a lifesaver for that person that collapsed. So that's the first thing you do. Start your CPR, call for help.
Okay, care to show us how CPR is done?
You mentioned something. The first lady mentioned something. When you have cardiac arrest that can occur anywhere, you have seen pictures of somebody, president speaking, collapse. You have seen a preacher preaching in the church, collapse. You have seen people in the market collapse. Last week, Saturday, I was at Amako. A man, my age, drove his car crying around 7 a.m. I just went there to get something to see what's happening in the hospital. 7 a.m. The guy was crying, "Doctor, please, my wife shouldn't die." Unfortunately, the lady who was brought in dead. I asked her what happened. She said, "This woman cooked for us last night. This woman played with the kids last night." And what they do, around 5, 6, they just had a sound. And what they did was to start carrying the child, the woman with the brother, start coming to the hospital. You see, that's doing the wrong thing totally, because every second counts in CPR. What's in the CPR thing? What component of human being is this? The blood, the heart pumps blood that gets oxygenated and gets to the brain. So what we are doing in the CPR, cardiopulmonary resuscitation, we are trying to resuscitate the cardiac and oxygenating it that will keep the blood circulating until the help comes. I don't know whether you're understanding me.
Yeah.
So first thing, because sometimes people, as he mentioned, somebody can collapse, but the person doesn't have a cardiac arrest, right? Yes. If you have hypoglycemia, you have collapse,
Yeah.
but you don't have
Cardiac
arrest. Do you understand what you mean?
Yes.
So that's why we were saying a lot of things that could be a cause to that. And I will tell you something that is very bad. And the first lady said it. We did, because during training, I'm a HA trainer on basic life support. During training, you give people what we call pre-test. You found that even 80% of healthcare workers don't know how to do CPR in Nigeria.
A lot of
Effective
effective
CPR.
ones. Yeah.
Oh.
Yes. Now, even outside the country, you see dogs do CPR.
Dogs?
Yes.
Wow.
Because you are going to train the dog. Because you, as a human being, you will be happy for him, for her, everybody to know how to do it. Because when you collapse, they are the one that will resuscitate you. I don't know whether you're getting me. So we just do a practical section. We have, let's say, Jones and Dan, yeah. So yeah, and the cardiac arrest will occur in a child. Yes, and the two next one we could do a child have a foreign body that will collapse.
Okay, that is lodged in a person.
Yeah,
That one
for
is
collapse.
detailed.
Okay.
Then, yeah, the cardiac arrest, and who classify it, the most common cause of cardiac arrest in adults, they are the common cause. That's the cardiac cause, the cardiologist. But in children, the most common cause is respiratory. Do you understand?
Okay.
That is airway blocking, giving them this thing. So we assume that we're having adults today, which could be this thing. So I don't know how can we go about it, because we have the stages in the CPR, so we could explain to people when someone collapses. First is this: you must ascertain that the person has collapsed, and what you are going to do, you just witness, because there's something you have: witness collapse and unwitness.
Yeah.
Witness that you walk in, you didn't witness that one, but this one witness, it happens in your presence. Then if you have every other person around, it's good. That's why in Anambra State, first state in Nigeria that started emergency medical and ambulance system. We started it at 112, started it functional with every other line. Though we're having problem connecting with MTN now, we're trying to resolve, but toll-free line. So first you have somebody that have collapsed. What you do, please call me ambulance system, call 112, tell them to come in with AED. Because in AED, in cardiac arrest, look at it there, the AED, that's what it, automated external defibrillator. If you are unable to defibrillate somebody that had cardiac arrest, this could be the cause. It's a machine that what it does is to electrically reset the abnormal electrical activities in the heart. And it's a very simple way to do, because I think outside the country, where you have 50% or is it 50% or 100%, there must be an AED there. That is a must there.
Yeah.
When you have gathering of more than 50 to 100, there must be an AED there. So you train people on that. So first thing you do when somebody has had cardiac arrest, you just first also, I don't know, okay, I will bend down small. You will also check your environment.
Oh, okay. What are we checking for?
Yes. Safety. He mentioned it.
Safety, yes.
So if people are Boko Haram are killing people here, I see somebody collapsing, you won't come and say, no, you have not how to do CPR, you want to demonstrate it. They will kill you, or there's fire incident here, and somebody collapsed. So first is that you take the person to the area of safety, where you also be safe. But if you are not safe, one, instead of having two casualties, one is better, you continue here, because I'm not saying that you might even resuscitate the person. Do you understand what you're saying? So safety, you ensure that there's safety of the person. Then you call, please, I have an emergency, call 112, or call hospital to come in with ambulance and AED. Then you must ascertain what he mentioned. Cardiac arrest could be, some sudden collapse is not cardiac, it's not a must, it will be cardiac arrest. Then put the person on a surface that is hard.
Why?
Because what you want to do in cardiac arrest, there's two components that you want to do in CPR. You are trying to compress the heart. You are coming to compress the chest so that it will hit the heart. You understand? So you want to get the heart restarted, and also you are giving air. So if you put the thing in a soft surface, as you compress, it's a compress. The pressure will, so you're not trying to get one.
You're not getting the...
Yes, because the idea is that there's something we call high quality CPR. The component is first, start CPR as soon as possible, at least within 10 seconds, right? If it is two, do compression, chest compression, fast and hard. Fast in the sense that you must push hard. If it's an adult, you are trying to get 1/3 of anterior posterior diameter. What's anterior posterior? Back and front. It may not compress 1/3 of it, so you'll be able to get the hand. The third one is this: you must push fast and also ensure that there's a recall. Because when you push and recall, blood return, and you push again to pump the blood, then the blood will come. If you push fast, the heart will be empty, isn't that so? They return. What is it called again? The blood return to the heart will be reduced. You understand? Then the third one you must do is this: the ensuring that and before you start the high quality, somebody has gone to get a call for help, and you start your compression. So this is a simple thing to do. So sequentially now, these mannequins, assuming it's an adult too, because if a child, this thing, like say an infant, you either use your hand or one hand, and you are trying to compress at a rate of, you are trying to do diameter compression, 1.5 inch. What if it's an adult, 2 inch? That is 4 cm for children. So you will not be able to whatever. And you want to compress fast and hard. That is 100 to 120 compression per minute. And you give breath at 1 breath per 6 seconds. Okay, let me demonstrate. So first, when you have CPR, it's not a praise. When somebody, you must see their adrenaline flushing out. So first, hello, can you hear me? Now you have an unresponsive. You now say, yeah, after checking for your environment, because that's the first thing. Please, I have an unresponsive patient. Activate 112, call for emergency, come with ambulance and AED. So you have already come there. Now, you check for the pulse. The issue now, the point is that you can't do the chest compression. The essence of the chest compression is to ensure that it's a return of circulation. Evidence of return of circulation, that movement, the patient will cough, and also you can see the pulse coming out. That is evidence of return of spontaneous circulation. That is what we call it. So you see the movement, coughing, and also pulse coming out. So first, you have called for this thing. You check. One is this, in adults lying like this, if you check your neck, there's a groove. When you run it down, you see a groove there. Press it deep, you see a pulse there. No, look at it. If you put your hand here, you run down, you enter a groove between your trachea and this thing.
Yeah.
So deep inside it, you could see a pulse.
Yeah.
Are you feeling it?
Yeah.
That's one way you can get a pulse in somebody. So if you do that like this, you don't get it. Then you can get this one, radial pulse for adults and all that. But if you don't do that, you have another response. So you move, you put your head like this. Look, as you're looking, you're checking if there's chest movement and you know when you're breathing, you can put your breathing coming out. So now you're not getting all that. You have already checked. Mr. John, can you hear me? The person is not hearing you. You have already activated the emergency. There is no pulse. That has made it to have a cardiac arrest. Unresponsive person, no pulse, and no respiratory effort. But you can have in some instance, somebody can collapse. You check, he's breathing, the pulse is there. It's not cardiac arrest.
Okay.
You understand? So what we're going to do now, first is that because it happened, there's something we call chest-only compression. For the purpose of the train, I will just open this thing. There is a bone here. What you do between the navel down.
Yes.
You press your hand.
Yes.
And what we see that between the navel line, the bone there, you can feel a bone.
Yeah.
Yeah. So you put your 2 hands, lock it. This your chest will be directly opposite this, and you start compressing. You remember you are compressing to get at least 100 to 120 compression per minute. You can see it. 1, 2, 3, 4. You see the way we are not doing like this. We are not doing it in the stomach. Between the nipple line at the center, you see a bone there. You are not doing it in the stomach, and you are not just doing it like this. You must push fast and hard and allow for a call. Or we can say 1, 2. You can't do this in more than 2 seconds if you do it very well. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 30. And now when you do, you can give
mouth to mouth.
No, mouth to mouth. What do you think about mouth to mouth? Because we are talking about in the society now. Okay, there is something we call shade. I know we have it here, but it's not that available. We have what we call the shade we use to give that. But in the other actually, when you come outside, it's not there. So what you do most times, because what you want to do is to give air. The air you breathe in now, here inside this room, is 21% oxygen. Now, the one you exhale is 17% oxygen. So what you want to do now, remember, you want to give the person compression and activate that blood that is going to have some level of oxygen. Okay. So what you do is that you must give this. But if you cannot able to do this, continue chest compression until help comes. But if you are trained to do that, this is Ampubag, it's in the hospital setting. If you have this one, it's a good one. Your patient will not die immediately. You can actually do that. I can demo. Okay, this is a smaller face mask, but it's a smaller face mask. But if you have to use this, you can see you can see the chest rising. Can you see it? Rising.
Okay.
You can see it rising. But in this hospital, when you have got this small face, but if you don't have it, like something we call ensure that you won't have some contacts, some fluid and all that. All you do is you breathe in and do like this, close the nostril, then can you see?
Yes.
You do it 2 times and continue the chest compression. And the process of doing the chest compression, it shouldn't delay more than 10 seconds.
Okay, well,
Because the gain you have made in doing chest compression, you lose more when you restart.
Okay.
Do you understand?
Yeah.
So it's something that you shouldn't spend less than 10 seconds in all this thing. The more you have breaks in doing it, the less chances, far less chances of the person surviving. So even when you are tired immediately, you have another person take over.
Okay,
So they
taking
will do it until
over.
what we call the AED. This AED will demonstrate it. We'll have it, but if there is no time, we can push this next time, the
That's
AED.
all right. No, we do.
So this AED,
Sharp,
if
sharp.
it comes, it is very simple and voice directed. You'll be doing this, when you must be doing the chest compression
what you're trying to
while you are doing this thing. So probably, Dr. Mwaba, you can be doing the chest compression. If
So,
you can continue doing the chest compression. Where now, look at it. It's very simple. This AED to use. If you look at the pad, it shows where you're going to put it. You can see.
Okay.
But as you are putting it, you must remove all the clothes
All
the
the
person is
clothes.
putting. Then if there's water, there is another place because there's cardiac arrest for somebody that is drowning. Someone that's drowned that they brought out.
Yes.
You must, that one is more of air you are giving the person. So this one now, you see it now. You put it at the ankle. Yeah? It's well explained. Like this. The other one, you see? You put the other one at the axilla, like 5 to 6 meters down the axilla, yeah? Put it here. While you continue doing your CPR, then the computer will tell you, see, it will tell you something now.
Begin. Place pad exactly as shown
So
in
it's
the picture.
voice prone.
Press firmly to patient's
You will
bare
be doing
skin.
this thing until he will tell you to. You understand? So, I
When
will
the
do.
first pad is in place,
Uh-huh.
look carefully at the picture on the second pad. Peel the second pad from the
So,
yellow plastic
while we are
lining.
doing the
Place
CPR.
pad
So these
exactly
are
as shown
it's
in the picture.
a
Press
voice
firmly to
driven.
patient's
So,
bare skin.
so as if it makes the person is to shock, you just press here. Yeah. The shock we give to the person because there's something we call the
When the first pad is in
shockable
place,
readings.
look
I think
carefully
all
at
know
the
about that.
picture
That
on the
is
second
postvenous
pad.
ventricular
Peel the
tachycardia and
second pad
ventricular
from the
fibrillation.
yellow
Yes.
plastic
Two of
lining.
them.
Place pad
Shockable
exactly as shown in the
So if you shock it, the
Press
person
firmly
gets
to
himself
patient's
and
bare skin.
there's
Press
return of
pad
circulation
firmly to
this thing.
patient's
Because what this
bare
is trying to do,
skin.
as the heart is beating it's going to, the heart is
Make
beating
sure that
chaotically.
the yellow plastic
So the
liner
essence of
is
this thing is to
completely
make
removed
the
from both pads.
what was it called
Place
again?
pad exactly as
The electrical
shown
activities
in the
to
picture.
normalize.
Pads must not be touching
So-
clothing
Wow.
or each other.
That's
So let me off before they will shock us because it will transfer the
That's-
this.
Press
It's
pads
still on
firmly
now.
to patient's bare skin.
Please. I don't want to scared of it.
Yeah.
Let's see. The thing will shock. We're already shocked. I know that is why it's because it will change your electrical activity in the heart. It is. Yeah.
Oh, wow.
Yeah.
I know.
If someone has cardiac shockable reading, cardiac arrest, with this, if you see the person coming up.
Oh, wow, this is interesting technology. It's massive. Well,
And we have enough of these
Yeah.
things
We
in the
have
States.
this. I went to borrow this one from the secretariat today.
Yeah,
Wow.
that's very good.
We had some and we want us to distribute some.
Awesome.
Some other.
Awesome.
Yeah.
this is lovely. It's
It's a
very,
lifesaver.
Indeed, it is. It's really a lifesaver, and I know that people. I know this program is going to educate a lot of people. Most people like us that don't even know how to do CPR. I'm sure this is going to be really helpful. We're still talking about uncovering hidden death threats, and I want to thank Dr. Wamba. But before we go, we'd like you to just, a word of advice for people with regards to paying attention to their body when they notice strange things that are not normal.
So my advice is for people to make it a routine to go for checkup once a year. If you are between 30, 40 years, you must get an ECG every year. Your blood pressure, your sugar level. Also, if you're over 40 years, you must do an echo, an ECG every year. Now, if you have high blood pressure, don't say that when you take the blood pressure medicine, BP goes down, you stop. Make sure that you see your doctor. If your blood pressure is not well controlled, make sure you see a cardiologist, because high blood pressure can cause coronary artery disease, which can lead to sudden cardiac arrest and sudden cardiac death. Also, if you have diabetes, which we call high blood sugar, if your sugar is high, make sure you take your drugs. If your sugar is not well controlled, make sure you visit a cardiologist or an endocrinologist that will control your sugar. Also, as Her Excellency said, exercise is very important. Getting 8,000 steps every day is very important. If you can do exercise 4 times in a week, 2 hours every day, 4 times in a week, that is recommended. Also, diet is also very, very important. When you do all these things, it will go a long way to reduce this syndrome we have in the society that they are called sudden collapse, and that will lead to sudden cardiac death.
Okay,
Thank you.
Mr. Commissioner.
Yeah, just to ask people to adhere strictly to what Dr. Wambra said and make use of the facilities available to them. And well, I want to ask one person before we go. But what was the controversy between this cholesterol? Yesterday, somebody sent me that we should be eating cholesterol, that there's no more cardiac-related issues. I said that way from American Cardiac Association.
Actually, as a cardiologist, at least I've had some experience in Nigeria and also in India, where I did my training. Cholesterol, if it's high, is not good for the system. What happens is, cholesterol, what does it do to the system? The blood vessel is where blood passes through, because the blood from the heart pumps blood out. It passes through the vessels to get to the vital organs. And also remember that heart also is an organ, and blood supplies the heart that pumps blood out. So this heart, that vessel that supplies the heart, they have smaller vessels. So what cholesterol does is that after a long period of time, it's like fat. When someone says this person is big, they are fat. The tissue contains excess what? Fat. So when there's high cholesterol, the fat start building inside the what? The walls of this vessel. And after some time, the lumen, the inside one we got what? Gets reduced. So when the heart pumps blood, it can be able to do what? Reach out to the vital organs. For instance, if the heart is involved, it will lead to what? What we call heart attack. Exactly. So cholesterol, if it's high, you have to reduce it. But the controversy is that the body requires what? Cholesterol. Now, that's why you have what? Range. There's level that will be in need to be what? To
high.
Treated. Also, there is good cholesterol, which we call HDL cholesterol. This one is also good cholesterol. Bad cholesterol, which we call low density LDL, is bad. So we have the cutoff range, so we know when to treat. However, it's bad. Then when you have other risk factors like diabetes and also hypertension, the risk do what? Increases higher. So these things, we look at, we factor everything before we treat someone that has cholesterol. However, if cholesterol is even not high and someone has diabetes and hypertension, that's cut off. More than 50% of upper limit, we do what? We treat. So cholesterol, we treat when it's high. Thank you.
Thank you so much.
You know, as we are just listening to all those things, Her Excellency was just, he would just give the abbreviation. She would maybe she missed that. She just read it. Because she knows everything. She just completed it for you. All right, your last message say to the people watching, why it's important that everybody should pay attention to what they eat?
Yeah, thank you very much. I think everybody should pay attention to what they eat. You know, we should eat right. Cut off over processed food. If possible, every processed food. I know we can't really cut off 100%, but cut down as much as you can. Eat natural food, very natural. Take care of your body. Exercise, as we say here, because we get a whole lot of all these vitamins, our antioxidants from natural foods. And that's basically it. Do our exercise, and we are fine. We are fine. Then do our routine checks. If there's anything you notice, you fight early, and that way we'll be good.
And if you do all those things, like Her Excellency will always say, you need to stay healthy. Because if you're healthy, you're going to be.
You'll be happy.
Indeed.
Always.
All right, so I want to thank Dr. Nwabara Chukwu, the Interventional Cardiologist Fellow. Thank you, sir, for gracing us with your presence and educating us today. Thank you, Doc.
Thank you.
Thank you
Okay,
so much.
we're not going to forget our Honorable Commissioner for Health, Dr. Afam Obidike, who took our time to tell us the practical aspect of
No, but
CPR.
you have actually introduced me to that intensivist. Yes, and that's it, an intensivist.
Intensivist, he's not here as a commissioner.
No, not here as a commissioner.
Thank you.
And not here as our coordinator. He's our great coordinator of the initiative.
Wow. Well, you took our time to explain. I'm sure a lot of people must have learned one or two things. So when there's somebody collapses around you, please do not make videos. Rather, lend a helping hand. Give the person CPR, call an ambulance, and just help save a life today. That is what we are saying here. You know, this is still Nonye's Healthy Living Show, and the essence is to stay healthy and to stay happy. See you next time on the program. I'm Priska Nwoko. Thanks for watching.